Monitoring babies is extremely important. Clinical trials and other studies have repeatedly shown that regular monitoring at the correct times reduces mortality.
In this video, we will show you how to monitor a baby on CPAP.
When monitoring babies on CPAP, we will be checking two things. First, we need to make sure that CPAP is working properly, that the baby is actually receiving the prescribed levels of air and oxygen at the correct pressure. We need to check that the circuit of air and oxygen has not been interrupted. The second is to check the baby's vital signs to see if they are responding to CPAP and to check for any complications. The first monitoring should be 15 minutes after the baby goes onto CPAP. Check again after an hour. After that, if there are no changes and the baby is stable on CPAP, then normal monitoring should be every 4 hours. However, if the treatment needs to be changed, either increased or decreased, you always need to monitor 15 minutes after the change. And monitoring can be done more frequently if patients are very sick and they need watching more closely. So, first of all, wash or sterilize your hands. If you are moving from baby to monitor and fail to wash your hands between each one, you could spread a fatal infection to all the babies in the unit. First, check the prongs are in place and that the hat is on properly.
Also, make sure you are still able to see the lines on the nasal prongs. After 1 or 2 days, some prongs may be loosely fitting, so you may need to change the prongs, but in our case, the prongs are still tightly fitting.
Make sure the prongs are well adjusted on the hat clips and tube clip.
Run through the length of the connecting tubings to make sure that they are not kinked anyway.
Now check the CPAP settings are correct.
Look at the oxygen flow, total flow, as well as the water. Also make sure you check to see if the water is still bubbling.
The water will tend to evaporate over time, so you might need to top it up. To do this, you use a syringe with catheter tubing. This fits into a hole on the lid, and you can simply add the water. If you are using a concentrator, make sure the low oxygen alarm has not come on. If everything is working well, move on to assess the baby.
You need to add saline drops.
You need to put a saline drop in each of the nostrils. Briefly take out the prongs to do this. The drops are very important to stop the baby's nose from drying out, which can lead to complications. Make sure that the septum is not damaged. If either nostril appears blocked, then you need to suction the baby. When you put back the prongs, make sure the water starts to bubble. Next, unwrap the baby and check for other complications, such as abdominal distension. Doing this will also allow you to assess if the baby still has increased work of breathing. If you see a sudden change or increased work of breathing, then this could be a pneumothorax or collapsed lung.
And after all that is done, make sure the baby is covered, and remember to feed the baby as needed.
You need to check and record the saturation levels, the heart rate and respiratory rate. Depending on the results, the CPAP treatment may need to be adjusted, using the algorithms for increased CPAP or weaning off CPAP. You may find it easier to remember everything you need to do for monitoring babies on CPAP by using the word dope. you need to check for D is for displacement of prongs, O is for obstruction of prongs or tubing, P is for patient problem, E is for equipment failure like a power cut or a tubing leak.